Greetings and welcome to another edition of Montpelier Connection. We are broadcasting from the Statehouse today. This is State Representative Mike Mwrowicki along with Representative Tristan Toleno of Brattleboro. The governor has just presented his budget address, and it's one of the things we'll be talking about here in our first update from the Statehouse on the 2016 session. So thanks for taking the time,
Thank
Tristan.
you very much.
Now, you are involved in some things that are happening in the Senate right now, right?
Well, I am. I think the Senate has been working hard on a bill that the House passed last year, which is an earned sick leave bill that I was the lead sponsor of in the House, and kind of keeping an eye on it while it's in the Senate. And I think that they're in committee with it right now and doing some good work to try to understand our approach and understand what the opportunity is there.
Yeah, well, good. I hope that goes through. It's something you certainly worked hard on last year in the House.
Thank you. Yeah, I did.
And hopefully we can get that through. Governor just presented his budget address. Anything jump out at you that you want to comment on?
You know, I think more than any substantive piece of what the governor said, I think I'd like to just comment on the overall approach. And feels like year after year there's been a lot of storm and strife about, what kind of gimmicks or kind of strange decisions are being made, or people hear lots of stuff along the way. Sometimes the process can be a little messy, and they start to panic. And what I heard today was a really thoughtful and modest approach to presenting a budget. And to me, it sounded like a real focus on the kinds of values that Democratic leadership supports and has tried to push forward for our state, and balancing that with a strong sense of limits and affordability and an understanding of what we can do to improve people's lives while living within our means. To me, it was a very strong budget address, in part because it was modest.
Yeah, and I think it's a stark contrast to the opposition we hear, which is basically no, 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 no. And when you ask about details, they are not forthcoming.
Absolutely.
Yeah. I really appreciated that the governor reminded us that where we've come from, when he first took office, we started with the Great Recession was in full bloom.
That's right.
Or full descent. We've certainly come a long way from there, and despite all that, the governor, we balance the budget every year, and I go back to the bond ratings we have and why that is, and the top three bond companies say we have sound fiscal management, and that's one of the reasons our bond ratings are so high.
And there's no question about that, and I may have mentioned this with you before in a different conversation, but I think one of the things that we hear out there is, well, we've got to get more jobs, and it's never a bad thing to have more jobs, so I'm certainly all in favor of us expanding the opportunity out there. But in fact, the reality is that in many communities, we're looking at situations where there are many, many jobs that are open, and we're having trouble staffing those positions. And so there are reasons for us to look at the job market, look for opportunities to improve our workforce training and development programs, but the narrative that what we are in is we're in a job crisis because we don't have enough jobs is less accurate. We are in a different kind of crisis.
Worker shortage.
We're beginning to be in a legitimate worker shortage, and part of it is geography. So there are places where they're having a really hard time hiring, even for decent jobs, and these are not only bottom of the barrel jobs, and that says something about where we are, how we've emerged out of the Great Recession, and also some of the challenges that we have to make sure that all Vermonters are thriving. And I think that that's a goal, a value that we hold, and we're going to keep working on it.
Yeah. The governor also mentioned some services that he's been especially keen on. Mental health has been an issue that he's been really supportive of, whether it's addiction services or mental health services. And unfortunately, the specter of suicide raised its head publicly again recently, and governor made sure to let folks know this is something we need to keep addressing and put some money behind it too. And there are folks in Brattleboro that are glad to hear that he's promising some extra funding to the for the suicide prevention efforts in Brattleboro.
Yeah, I know a couple of families from the Brattleboro area very well who've had devastating losses, and I think that the cost to all of us is so huge, and I'd love to see what the governor's plan is, but I certainly applaud him for raising the issue, for acknowledging how tough it is, and also for acknowledging that we can work to make things better, and I'm all behind him on that one.
Yep. Something that's probably going to get a lot of attention from the medical profession. The governor has been trying to address the Medicaid shortfall. He'd like to pay Medicaid providers more. He'd like to make sure we cover the costs of those we sign up for health care.
Yep.
Last year he put a plan forward that I supported. He wanted to put a little payroll tax out there and leverage that money to draw down federal funds. And we didn't go for it last year. This year he is suggesting expanding the provider tax, and not at the same rate that hospitals pay, but that money would go again to leverage federal Medicaid funds and help pay Medicaid providers more and pay for those Vermonters who get their health insurance through Medicaid. Any thoughts on that?
Well, I think it's a promising idea. There's no question. No one wants to have a tax imposed on them, particularly those. I would say that the people who are treating the most Medicaid patients in the system and are vulnerable because of the low reimbursement rates are certainly going to be troubled by being also taxed and asked to be part of the solution. The fact is that if it does what he says it does, which is to move more money into their pockets than it pulls out of them, by sort of spreading that cost throughout the whole provider system, then I think it's a promising idea, and it's worth looking at. And I think everybody recognizes that we have to do more to affect the reimbursement rates for primary care, and I know another issue that I've certainly been talking a lot about with people is the ambulance services. We have no question that we need to keep a really strong ambulance system in place, and they've also had it very rough in the Medicaid reimbursement.
Yeah, Drew was just
problem.
up here
Yep.
from Rescue Inc. and reminding us that they haven't seen any increases, yet their costs keep going up, and the requirements for them to provide the services continue. So hopefully that can be used.
People forget that it's when we figure out the gap that there is in Medicaid. What we know about that is that it's not that the money isn't being spent in the system; it's that the money isn't being spent in a way that's easily planned for.
Yeah.
So those costs get shifted over to private insurers, and they pass the costs along to the end consumer. So we're all paying for it in some way or other already. It's just a question of whether we can pay for it in a way that makes the system more rational and helps everybody get the outcomes that they deserve.
Yeah, and I think that was illustrated in the talks around education funding right now, because it's clear one of the concerns is the cost of health insurance to schools. But as it was been pointed out by numerous sources, that 8% increase, half of that is a cost shift of the Medicaid cost shift we didn't fund last year. So that gets pushed off to Blue Cross Blue Shield and the other health insurance providers here, and then they pass it on to their subscribers, and it's a negative dynamic.
There's no question. It's a very negative dynamic. We need to do structural kind of solutions in order to make that system more rational, and you can't make those structural changes without looking at revenue sources, and it's just important for people to understand that just because the governor proposed something doesn't mean that that's going to be what we do, but we have to do our due diligence. We have to be responsible and vet these ideas, particularly if they're new to us. If sometimes these ideas have been around for a while, and they keep getting rehashed, and sometimes they're relatively new. And Governor proposed a couple today that I think could be considered to be sort of newish ideas or brand new ideas, and they'll get scrutinized by our committee process, and certainly if they have merit, I think they'll rise to the top. And if they don't, then we'll be looking for other options.
Yep. And it's a good point. We may not wind up in the same place, but I think the governor's leadership is putting these things on the table. Similarly, with his plan to move forward with an all-payer system, the Accountable Care Organization, which would be a move past the fee-for-service structure that we currently have. And any thoughts on that?
Well, I think I support that move. Broadly speaking, I think everybody understands that a system that where doctors and providers can make a fair living by helping us stay healthy is a system that is the ultimate goal, and one where they make their living by giving more and more tests and more services that we might not need is a system that rewards them incorrectly. And it's not about whether or not the medical community should get fair reimbursement for their services. It's how do we do it in a way that supports health and not necessarily just lots of activity.
Sure. And ancillary services should not be an integral part of their budget when maybe they're not always necessary. Yeah, the testing and a lot of other parts of the system.
We're also entering into this, the era of big data, if you will. And what I mean by that is that, for the first time in the last 4 or 5 years, computer technology has gotten powerful enough to crunch very, very large data sets. And the ACOs, the Accountable Care Organizations, are able to collect non-identifiable data from patient records. And so if you have 1 million patient records being generated on a regular basis, and you're able to look, for instance, and see that a particular type of knee replacement surgery or a certain amount of rest before PT has significantly better outcomes. That's something that you can learn by looking at that across a very large slice of the system and learn from that and then make recommendations that improve outcomes. That's the kind of learning that we need to do from the opportunities that we have now with technology, and that's coming too.
You bet. And I think that'll help move the conversation from really what's been health insurance reform to actual health care reform, embracing population medicine, functional medicine, biological medicine, integrative medicine, things that focus on empowering each individual to stay healthy. And I hope that's where the conversation goes once we get the whole insurance thing squared away and settled a little bit more than it has been. We've got wonderful providers, Biologic Healthcare in Brattleboro, Sojourns in Westminster. They need to be a more integral part of the system.
I would agree. Yeah, absolutely.
You're back on the Agriculture Committee this year?
I am, yes.
And, what are you looking at now? Or what will you be looking at?
It's been an interesting session for me. I'm back onto the Agriculture Committee, and I also have a slightly new role within the Democratic Caucus in the House. So I've been brought in to be part of the leadership team. So I'm in and out of committee a little bit more than I was the last time I was in the committee. What I will say is that there are a couple areas of focus right now. We're looking at pollinator protection, and particularly obviously focused on honeybees as one of the primary sort of economic engines for within the ag world, and the vulnerabilities there. So we're looking at that issue. We're looking at some tax issues around what is agriculture and what things are supported through tax policy and what are not. We've been hearing updates about the water quality bill and where things are with that process. Some work being done on dog and I'm trying to remember the whole framing, but basically on outdoor shelters for animals, and doesn't include horses, but it's sort of small animals and how that can be done safely and effectively. And there's one other thing that has slipped my mind, but it may come back as we're talking.
Well, we've certainly got a long time to go yet in the session. Just getting started here.
Yep.
I guess for now that's about it from here. We look forward to updating folks again, and
I'd love to be a part of the conversation. Thank you for inviting me at any time.
Yeah, you bet. Well, thanks for taking the time, and thanks again to all the people back in Brattleboro, BCTV, for helping bring our work in Montpelier closer to you. Until next time, this is Representative Mike Mwrowicki from Putney.
And Representative Tristan Toleno from Brattleboro.
Bye-bye now.